Hello, everyone. Welcome to the sixth episode of Lamp Auricular Medicine. Today, we shall be locating the 5 points of the superior antihelix Crus, 3 points of the inferior antihelix Crus, 10 points of the lower antihelix Crus, and the 7 points on the back of the ear. Okay, let's start with the points of the lower limb. These are the 5 points of the superior antihelix Crus. The toe, heel, and ankle are the most easily located in relation to each other. In looking at the left ear of a person, these points form an inverted L. So 76 is the toe point. This is the most lateral point found where the inverted L begins. 77 is the heel point, located at the junction of the two strokes that form the L. 78 is ankle point, inferior to the heel point, where the inverted L ends. 79 is the knee point. This is the area superior to where the superior antihelix Crus intersects with the inferior antihelix Crus. 80 is the lumbago point, exactly at the intersection of superior and inferior antihelix Crura. 81 is sciatic nerve, medial end of the inferior antihelix Crus. 82 is ischium point, just below the triangular fossa in the inferior antihelix Crus, slightly medial to the buttocks point. So 83 is the buttocks, just below the triangular fossa in the inferior antihelix Crus, slightly lateral to the ischium point. Next, we go to the 10 points of the lower antihelix Crus, the thoracic cavity. We start with number 84, the abdomen. This is the area on the lower antihelix Crus, roughly parallel to the liver and pancreas gallbladder points. 85 is the chest area in the lower antihelix Crus parallel to the stomach point. Some describe the chest point as level with the supratracheate notch. 86 to 87 would be mammary points. These are below the chest area, parallel to the center of spleen point. These are actually two mammary points positioned side by side. Number 88 is the neck point, lower antihelix Crus parallel to the curvature of the antihelix above the antitragus. 89 is throat and teeth, below the neck point, slightly above the occiput point. Now let's go to the spinal points. The spinal points are found along the spine of the ear. So this is the spine of the ear, or the medial edge of inferior and lower antihelix Crura. Number 90 is the sacral vertebrae, area that extends from the most medial portion of the inferior antihelix Crus about parallel to end of the bladder point. Number 91 is the lumbar vertebrae. Extends from the end of the sacral vertebrae to roughly parallel to the middle of liver area. 92 is thoracic vertebrae, goes from end of the lumbar vertebrae to just above the curvature of the lower antihelix Crus. 93, cervical vertebrae, extends from end of thoracic vertebrae to end of curvature of the lower antihelix Crus. Some sources recommend locating vertebral points in the following way. Draw a line from the lower portion of rectum point, which is number 57, to where it intersects with the antihelix. Area superior to line is the lumbosacral area. Draw a line. The area superior to it is the thoracic area, and the area beneath it is the cervical area. Now let's go to the 7 points on the back of the ear. The vagus nerve, blood pressure, back pain, and brain function. So 94 is the vagus point. Depression just above the ear root, where the ear attaches to the head, above the tendon. To locate, gently pull the ear laterally. This will isolate the tendon to assist in locating the point. The point is in the depression above the tendon. Sometimes this point is called by its Chinese name, ermicum. 95 to 97 would be the upper back, middle back, and the lower back. This is along the spiny middle portion of the back of the ear. The upper back point is on top, middle back point is in the middle, lower back point is on the bottom. Number 98 is a very important point. We call this the lower blood pressure groove. This is a groove-like depression on the back of the ear formed by the posterior border of the helix. It runs the length of the upper third of the groove. 99 is the superior root of the ear, posterior aspect of the ear at the intersection of the superior part of auricle with the face. And 100 is the spinal cord, the posterior aspect of the ear at the superior border of the inferior auricular root. Now let's review from the start. So we have so far discussed 100 auricular points. Number 1 is Shenmen. Number 2 is stop wheezing point. Number 3 is hypertension point. 4, 5, and 6 are the sympathetic points. 7 is the uterus prostate point. 8 is constipation point. 9 is hepatitis. 10 is hip joint. Now let's go to the points of the head and face. 11 is upper teeth. 12 is the tongue. 13 is the jaw. 14 is lower teeth. 15 is eye. 16 inner ear. 17 is helix 5. 19 is helix 6. 18 would be the tonsils. And number 20 is insomnia point. 21 is thirst point. 22 is external nose. 23 is hunger point. This is a very popular point for those who want to lose weight. Number 24 is internal nose. 25 is adrenal. 26 is the wrist point. 27 is finger. 28 is allergy point. 29 is shoulder. 30 is elbow. 31 is clavicle. 32 is shoulder joint. 33 is thyroid. 34 is nephritis point. Next is 35. This is the mouth. Curves like a smile. 36 is the heart. 37 is trachea. 38 upper lung. 39 lower lung. 40 is esophagus. And this one is the cardiac sphincter, 41. So 42 would be the stomach. It's a round area here. 43 would be the liver. 44 is hepatitis point. 45 is relaxed muscle point. 46 is the spleen. 47 is the sanjiao. 48 is duodenum point. 49 is large intestine point. 50 is large intestine. 49 is small intestine point. 50 is large intestine point. 51 is the appendix, located between sectors 2 and 3, or between the small intestine and the large intestine points. 52 is bladder point. As you can see, this is the sector 4 directly above the large intestine point. 53 is kidney point. 54 ureters. 55 pancreas, gallbladder. 55 on the gallbladder on the right ear, pancreas on the left ear. Next, we have 56. This is the diaphragm point. 57 is lower portion of the rectum. 58 hemorrhoids point. 59 common cold point. 60 is ear apex. 61 to 64 would be helices 1 to 4. 65 is Ding Chuan point. If you remember, this is a very important extra point for wheezing, for asthma attacks. 66 is brain or subcortex point. It's located posteriorly. 67 to 69 would be occiput, temple, and the forehead. 70 would be the brain stem. 71 is I1, 72 I2, 73 is the raised blood pressure point, 74 is ovary testis, and 75 is the endocrine point located posteriorly. Thank you very much for your attention.